20,000 people die of cancer every day. This translates to 8 million deaths every year, 500,000 of which are Americans. At the beginning of the last century, 1 person out of 20 would get cancer. In the 1940s, it was 1 out of every 16 people. In the 1970s, 1 person out of 10. Today, 1 person out of 3 gets cancer in the course of their life. While in that tunnel, each patient feeds an immense medical apparatus that employs hundreds of thousands of people and generates millions and millions of dollars for the medical and pharmaceutical industries. From research laboratories to medical schools, from prevention clinics to worldwide drug sales. Today, the cancer medical apparatus is so large and expensive that it needs its patients in order to survive just as much as the patients need the apparatus.
Cancer is a big business, one of the biggest businesses. The typical cancer patient spends at least $50,000 to treat his or her disease. With 1 million new American cancer patients every year, that translates to $50 billion annually spent on cancer treatment in the United States.
The only thing that has not changed in the last 100 years is the apparent incapacity of medical science to understand and conquer a disease like cancer. Why? Today, the most advanced laboratories are working directly on the human genome in order to identify the genes that seem to be responsible, according to some scientists, for the different kinds of cancer. This opens the door to a dreamlike scenario for the pharmaceutical industry. A world where each patient would need its own personal cure, tailored to its own personal needs. 1 million new patients every year, 1 million new cures for each and every one of them.
What we want to do is we want to match the disease with the cure or palliative treatment, whatever it is, by using the genomic tools. And that's really what the whole cancer world is now going to be about for a very long time.
The question of whether we're going to break the cure barrier is not the question about if, it's a question about when.
In the meantime, however, no one has been able to prove that the official theory is the correct one, and that the origin of cancer is in fact of genetic nature. Despite such dismal results, official oncology continues to impose on patients the only 3 therapies that have ever been authorized in the last 100 years: surgery, chemotherapy, and radiotherapy. And 2 of the 3 are actually carcinogenic.
Surgery is the oldest technique and the most successful of the 3. But surgery is useful only when the cancer is localized, a minority of cases. Patients also fear radiation's dangerous side effects. One of these is that radiation can actually cause cancer. The use of radiation remains controversial even in medical circles. Chemotherapy is designed to kill cancer cells throughout the body. It is highly toxic, however, and it also kills healthy cells. Today, chemotherapy is often given in combination with surgery and radiation.
Your typical chemotherapy agent will certainly cause tiredness. There is a risk of sickness, but there are very good anti-sickness drugs these days that can control that. Chemotherapy frequently causes taste change. It can cause a sore mouth. The first side effect that many people ask about, however, is hair loss.
In fact, many chemotherapy drugs are carcinogenic. Their toxicity is so high that all personnel handling them must observe very strict safety rules. Their disposal calls for total destruction and incineration of anything that comes in contact with them. Some of these drugs remain partially toxic even after incineration beyond 1800 degrees Fahrenheit.
If conventional therapy has such limited results, why isn't the medical profession willing to investigate alternative approaches?
The answer to this question may be found in some historic events that took place almost a century ago, when official medicine finally managed to gain the upper hand on the so-called empirical doctors, who cured patients with herbs and natural remedies.
Of medical power remained equal until the turn of the century. Then, new medical treatments emerged that were potentially very profitable. The AMA joined with strong financial forces to transform medicine into an industry. The fortunes of Carnegie, Morgan, and Rockefeller financed surgery, radiation, and synthetic drugs. They were to become the economic foundations of the new medical economy.
The takeover of the medical industry was accomplished by the takeover of the medical schools. Well, the people that we're talking about, Rockefeller and Carnegie in particular, came to the picture and said, we will put up money. They offered tremendous amounts of money to the schools that would agree to cooperate with them. The donors said to the schools, we're giving you all this money. Now, would it be too much to ask if we could put some of our people on your board of directors to see that our money is being spent wisely? Almost overnight, all of the major universities received large grants from these sources and also accepted 1, 2, or 3 of these people that I mentioned on their board of directors, and the schools literally were taken over by the financial interests that put up the money. Now, what happened as a result of that is that the schools did receive an infusion of money. They were able to build new buildings. They were able to add expensive equipment to their laboratories. They were able to hire top-notch teachers. But at the same time as doing that, they skewed the whole thing in the direction of pharmaceutical drugs. That was the efficiency in philanthropy. The doctors from that point forward in history would be taught pharmaceutical drugs. All of the great teaching institutions in America were captured by the pharmaceutical interests in this fashion. And it's amazing how little money it really took to do it.
Surgery became viable with anesthesia and infection control, and doctors advocated expensive, radical operations. These in turn produced the need for a large, lucrative hospital system. Radium fever swept medicine. The price of radium rose 1,000% almost overnight. Another costly technological industry entered the hospital system. A drug industry grew out of the booming patent medicine business. The doctors changed educational standards and licensing regulations to exclude the empirics. Soon, only AMA-approved doctors could legally practice medicine. In a brief 20 years, the AMA came to dominate medical practice. Organized Medicine launched a media campaign to associate the empirics with quacks. The code word for competition was quackery.
So now, the average doctor goes through school. He gets a great education. He has to be really smart to get through it. He learns all about drugs. He doesn't know too much about basic nutrition. I found that the average wife of these physicians knows more about nutrition than he does. But they sure know their drugs. And if you go to your typical doctor today, I don't care what it is, chances are you're going to walk out of there with a prescription. Why? Because that's what he has been trained to do.
The companies that make up the pharmaceutical industry are among the largest corporations in the world. Together, these businesses have come to be known as Big Pharma. In 2004, their combined global sales were over $500 billion, with Pfizer and Johnson & Johnson leading the pack. In the U.S., the core of Big Pharma's immense profits is from sales of prescription medication. And since these drugs can only be prescribed by medical professionals, most of the industry's promotional and marketing activities are directed at doctors, pharmacists, and other healthcare providers.
Clinical research was funded by the National Institutes of Health. During the 90s, most of that research got pulled out of universities and was brought to for-profit research organizations. The problem is that gave virtual complete control over the research to the drug companies. They could design the studies, They have control of the data so that many of the authors of the most important articles published in our best journals aren't even allowed to see their own data. They don't get free access to their own data. And they have control over publication.
To sum it all up, the pharmaceutical industry first gained control of the teaching system. Then it gave the AMA the power to exclude all other doctors from practicing. Then it took over the entire drug testing process, while heavily influencing the medical publications that reviewed those drugs. And finally, Big Pharma extended its control over the federal entity that is supposed to verify those drugs' safety and efficacy. At the opposite end are the sick citizens, and in the middle are the doctors who must cure them based on information they can only get from the pharmaceutical industry, which can no longer be verified. Chemotherapy drugs are in fact among the most expensive of all. A 1-month supply of erlotinib, a chemotherapy drug produced by Roche, costs $2,300. The same supply of sorafenib, Bayer's chemotherapy drug, costs $5,500. The monthly supply of sunitinib, a chemotherapy drug produced by Pfizer, cost almost $7,000.
The drug industry is the most successful global industry in the world. What they don't want you to do is get better, because if you get better, their market's gone.
They're not interested in that. So, we translate that into the real world of FDA approval. Surely these drug companies aren't going to spend $20 million or more testing any substance from nature because it can't be patented. That, and of course the FDA says it's illegal to use unless it's been tested for efficacy and safety. Now you see the catch-22 you're in there. Nothing from nature, regardless of how effective it might be, will ever be proven safe or effective according to the FDA. It'll never be. Because nobody's going to spend the money to go through the test. So therefore, everything from nature will always be condemned by the FDA as unproven, an unproven cancer cure.
It needs a formal scientific review.
And when I say to you, all I want is to have them come here. The American Medical Association, the Pure Food and Drug, the federal government, anybody, come here and make an investigation. And if I don't prove to them beyond any question of a doubt that our treatment is superior to radium X-ray and surgery, then I will lock the doors of this institution forever.
But the medical profession did not respond to his call.
I'm swimming in blood now. They've done everything they possibly can to try to humiliate me. They've had me in court many, many times. But do I care about that? I'm not thinking about what they're doing to me. I'm thinking about the 12,000 patients who's under treatment observation here at this clinic. I'm only thinking of one thing: suffering humanity.
But the government did more than just warn the public. Although federal prosecutors couldn't prove the treatment was worthless, they did outlaw it on technicalities like false labeling in interstate commerce.